A cracked tooth, a toothache, or just something stuck in your teeth happens pretty much all the time. But have no fear, one of our favorite dentists is here with what you need to know just in case you have a dental emergency. We welcome back to the show Dr. Marci Guthrie. Always wonderful to see you, Doctor.
Thank you.
Okay, Doctor, tell us, we have this long list here. Let's just jump right in. Dental emergencies, I know we always have appointments with the dentist, most of the time. But you get to see people that come in with dental emergencies. What are some of the most common emergencies that you are seeing?
Usually maybe like a fractured tooth. Somebody was eating something, they broke their tooth, and they call in, or they have an abscess, a swelling or infection like that that's painful, that calls them in to seek treatment.
And you know that face too when it happens. You've seen that if you're a friend or family member and you're at dinner, you see their face and you know just what happened. It's the cracked tooth.
Right.
Tell us about a toothache. How can that be prevented, first of all?
So seeing your dentist regularly
Yeah.
is the best. Brushing and flossing, obviously, after every meal.
Mm-hmm.
You know, toothaches more often are caused by cavities that have been left untreated. So they like to give you symptoms like something might be wrong, but it's just not that bad. And then it really becomes bad. It swells, and you're just in too much pain that you have to seek dental treatment.
You were mentioning something about the abscess. What is the abscess? And can that really grow into something that is something more serious and dangerous?
The abscess is a bacterial infection that has gotten into the bloodstream. It can either swell or it can drain. So bacterial infections left untreated can become life-threatening. So they definitely need to be treated as soon as possible.
Life-threatening, something in your mouth can be life-threatening?
Yes, it can.
What are some of the treatments for that?
So when there's an abscess, normally it's going to need either a root canal or extraction. So depending on the situation, you know, all emergencies are a little bit different with treatment.
Better than the alternative, though.
Yeah.
You know? All right, so we were talking earlier about some dental emergencies. You've had a few in your own lifetime.
I have.
What were they?
So my first dental emergency was I took a softball to my mouth, broke my front tooth, and it went through my lip. So I had 12 stitches in my top lip and an emergency room visit. My lips actually were so swollen that I couldn't seek dental care for a couple of weeks.
Oh my goodness.
So that was my first dental emergency. So the second was when I actually had a temporary and I had a crown. This front tooth is a crown since that, and I was eating something and actually swallowed the temporary. So
you swallowed the temporary crown?
I swallowed my front tooth.
Oh.
Yes. Needless to say, that was a Saturday, and I had to drive in and see the dentist because most people, when they swallow and they don't have their front tooth, they cannot leave or function, really. I mean, you can function, but you don't want to go to work and smile without your front tooth. Living
that is the window to the world.
Right. So
you have some show and tell right here of things to do, things not to do. Where do you like to begin?
So on the front side, you know, I want to avoid the candy,
right
the chewy crunchies.
But they look so good.
They do, but you know, I get teeth that come to me. These are a couple of broken teeth that have come to me in the last few weeks as dental emergencies. And
oh, really? These are broken teeth in this bag.
Yeah.
All.
That's one from one patient. This is one from a little older 93-year-old female, and she wanted to keep this little vial, but I asked her if I could use it for the segment because it's so cute. I don't usually get those vials. Usually it's a bag that comes in with a tooth broken.
This is going to be the most famous broken tooth in Central Virginia right there.
Yes.
She's going to get that back. Oh, I see it right there.
Yep.
Tell us why these are not our friends. These,
so the
these gums and Tootsie Rolls and caramel
chewies are not only hard on your muscles and jaws, but they can also lift out restorative treatment. The hard candies, you know, can crack your teeth, just like chewing ice, popcorn. Things can get stuck underneath your gums. So you want to avoid the sticky, chewy things. You want to wear a sports guard for contact sports. If I'd been wearing that when I was pitching softball, maybe I'd still have my front tooth. And
so you were pitching, and that's where you took that softball off?
I did. It took a bad hop off the pitcher's mound. And I didn't have a mouth guard.
I'm looking closely. This one has bling to it as well.
It does have bling. Yeah, they've come a long way, these mouth guards. Can be pretty stylish, I guess.
They really have. You know this one thing I always see people do, and tell me what you think of it. People use their teeth as a tool.
Correct.
Maybe opening bottles, opening
I've seen
cans.
that, yes, and that is something obviously not to do. Your teeth are meant for chewing, for speaking, not for tearing things open. So that's definitely a pet peeve of mine as well. Biting your nails, you know,
Biting your nails?
Biting your nails aren't very good
Well,
either.
we work in news, so there's a lot of people biting
Right.
their nails
Yes.
out there. So we'll have to go in and maybe wag your finger at the folks. You know, tell us about maintenance, Marci. We hear it all the time, brush and floss.
Right.
How much can that really help?
It can actually help a lot. You know, you'd be surprised how much food gets caught in between your teeth after you eat. So ideally, I think people should brush after every meal. It's hard enough to brush once a day though. But if you took the challenge of flossing after every meal, I think people would see how much actually comes out. So people that get stuff lodged into their gums can really try to get that out and create also infections as well. There's an attachment from the gums to the tooth, so if you jab that too much, you can integrate bacteria underneath your gums and create an infection. So, you know, it's good to go to the dentist and get the necessary treatment that they recommend before things or emergencies happen.
Great advice, as always, Dr. Guthrie. It's always a pleasure to see you. And she always has the show and tell. Remember to brush and floss regularly.
Yep.
All right, great to see
Thank
you.
you.
Come on back.